Today I'm gonna talking about assisting the patient to dangle. What is it? What is the dangle? The dangle is the position that change from the supine position go to the sitting position. Like individual is make change in his or her position, particularly when moving from the supine to the standing position. Some individual may experience of adopt in their back pressure on assuming the standing position when they stand. Is maybe dizziness, maybe fainting. So the dangling is which is often at the intermediary stage of the assisting the people into the sitting position with their legs and hanging over the side of the bed. So the bit before moving them into the standing position or maybe sitting the position is therefore used to ensure that the patient are moved safely. You need to make sure that it's safely, and this can help to prevent notable reduction in the blood pressure. And nurse therefore need to aware of the cardiovascular change and compensatory mechanism that take place during change the position from the supine position to the sitting position and to the standing position. You need to aware of this, and then this is order to able to make the decision not just about the whether the patient can be moved out of the bed, but so that can be done safely without any of the adverse effect of the change the position, and those at greatest risk of the developing such adverse effects include those who have diabetes mellitus and cardiovascular disease, or maybe also those who and aging relate vagal dysfunction. So they can be have the problem with it. So you need to avoid this patient. So we recommend for the practice include ensure that dangling the patient is incorporated as part of the procedure of slowly assisting the patient out to the bed. So and then you encouraging the leg and foot movement and continually assisting the patient during the procedure. Should any patient show any sign of tolerating the position change, the procedure should be held and the patient assist back into the supine position. If they have to tolerate with that, you need to stop and then go to the patient to the supine position because the patient can't really tolerate with that. Okay, so I'm going to demonstrate how to. Firstly, you need to identify the patient, and you need to know that this is the right patient or not. So this is a really nice patient. Oh, so this is alright. So second, you need to say the patient that what you're gonna do. So the patient, I'm gonna get you to do the dangle. Okay. So now can you please change the patient to a sitting position on the bed like this. Okay. And then you need to bend the knee of the patient like this. And then one hand you need to hold the patient shoulder and the patient neck, and one hand go to hold the knee of the patient, and then push the patient to the edge of the bed, and then apply the slipper for the patient that's not gonna sleep on the floor. So after that, you need to check the pulse of the patient and check the respiratory of the patient and the vital sign of the patient, because the patient can be faint or maybe collapse because the patient changed the position. That's why you need to check it. All of them, because the patient can be the diabetes, so you need to check all of them before you're gonna do this procedure. And after that, you let the patient do the dangle for 15 to 20 minutes. So let the patient do, and you need to be near around the patient. Don't leave the patient. So when you let the patient do for 15 minutes, you can let the patient to go to the reverse the procedure, the same position. To let the patient do like this and hold them. So you can lay down. Okay.